Hey y'all, I'm not really good at technology, so I'm just figuring this out. But we are talking about, is breastfeeding really supposed to be pain-free? Breastfeeding is not supposed to hurt. I got cut off on my last video, but I did want to share with you a couple of resources to help answer that question. One is going to be going over to milkdiva.com and going over to blog. It's the upper left-hand side. Is that true? No, it's the upper right-hand side. It'll say Diva Diaries. That's the name of our blog. There is an article there called Persistent Pain and Breastfeeding that will discuss some reasons that you might be having persistent pain and what you can do to address those things. I highly recommend to get someone in to help address the areas of concern earlier than later. That way it won't affect your milk production because all of these things can affect milk production, and of course to prevent risk for getting an infection or getting yeast or an overgrowth of yeast we call thrush, or yeast infection on the breast and nipple, which can cause deep shooting breast pain. So you definitely want to go ahead and address that right away. Milk Diva, we also offer web consultations or phone consultations. If you want just to do a little question and answer session with me, for about 30 minutes, we can set up a little mini consult, and that will help to answer short questions, maybe about pumping or about is my baby getting enough, or does my baby really need to see the pediatrician, or do I need a full consultation? So we can do a 30-minute brief question and answer. That's really good for maybe second, third time moms that just have some questions about maybe they have an oversupply and they're trying to reduce their supply, or people who are going back to work and want some tips and tricks. Sometimes those back to work ones take a little bit longer, more like an hour. But yes, there are resources for those of you who are not able to get out of the house because you might have several kids at home, you're far away from a lactation consultant, or financially it's going to make more sense for you to do a 30-minute or just a short video web consultation. So you go ahead and give us a call, 512-846-6455, or just go to milkdiva.com. You can click on the book now, and that has all the options for your mini consult, or if you want to take an online course or have a full consultation. I am here in Austin, so I do physical in-person consultations in Austin, Texas, and the greater area. But do not hesitate to send us a message, send us an email, leave some comments in this video. Let us know more information that you want to hear about more specifically. But go ahead and check out the blog called Diva Diaries over at milkdiva.com. There's also a frequently asked questions section, and that will address if my baby's getting enough, or questions like do I need to see a lactation consultant, or do I need to pump and dump? So we're going to talk about these in the future, as well as things like alcohol, antidepressants, contrast dye, surgery, those kinds of things, and how they affect breastfeeding, or if you have to make any changes, and if so, what those changes are. So keep up the good work, stay strong, and just do your best to enjoy your baby and stay healthy, okay? Thank you.